Whether you need general or specialized physical therapy, we're visiting Cranford. We're at ProTouch Physical Therapy. Scott and Zarina, it's so good to be in your 2,000 square foot facility. You guys have been here since 2015. Tell us about who comes to ProTouch Physical Therapy.
Everybody comes to ProTouch Physical Therapy. I mean, we see everything from pediatric patients to senior citizens in their 90s. We see all conditions. Myself, I have a scoliosis specialty, so I see scoliosis. I see a lot of vertigo patients. Of course, the standard orthopedic patients, post-surgical patients, even pre-surgical patients. I have college athletes that come in. Every kind of patient comes to us. And then Zarina, my partner, has a pretty highly trained specialty as well.
I do pelvic floor physical therapy, which is very rare in the state of New Jersey. We have a great team. There's 5 girls. We have 4 private rooms, as you could tell. And we treat women who are postpartum, who are pregnant. We treat people who have organ prolapse, extremely complicated post-surgical complications internally. We treat pediatrics with bladders and constipations, and males who have penile pain, testicular pain, post-prostatectomy complications. So it's a very niche specialty.
Looking at the website, I saw all the different types of PT that you offer.
Yeah.
What kind of things should people be looking for when they're shopping around for a facility?
Quality. They need to see that the owners are on the floor. Owners are treating all hands on. If the owners are in the facility, the quality will be high. And you could read the reviews, and if you see that every therapist is named by their name, you know they have a relationship with the patients.
Yep.
Yeah. Nowadays, I feel physical therapy has a really bad reputation where it's a conveyor belt of patients going in and out. There is no quality, there is no rapport. But small mom and pop shops like us, I think we're like the boutiques now of physical therapy.
Scott, I saw on the Facebook page that you were attending an event, it looks like. So where does continuing education and staying on top of your game, where does that come into play?
Continuing education for all physical therapy in the state of Jersey, there's a minimum requirement that you have to have. For us and for our team, we make sure that we go way above and beyond that. Like for us, we don't want to have just a minimum continuing education. We're all pursuing specialties. We're all pursuing specialty certifications just to make sure that we're on top of the game. We're up to like the standard of what's the newest thing, the latest thing, what's working, what's not working, just to make sure that we provide the best service we can for everybody.
So ProTouch is all about one-on-one work. What is it like for a patient who comes in? What does that personalization look like?
So when a patient comes in, first, when they make a phone call, Ashley or Amanda answer the phone. They collect the information. They do all the dirty work for the patient, the insurance, the registration. The patient is walked step by step before they even enter those doors. When the patient comes in, we greet them in, we take them into the private room. We collect all the information in privacy because I know patients don't want to disclose that in the middle of the gym. And then we make a decision with the patient's comfort zone. Do we treat them inside or do we bring them out here and they could participate in a bigger group with the rest of the patients? So again, it's a boutique kind of feeling when you come to ProTouch.
So everybody knows each other.
And we have heard during evaluations, I've heard this countless times, that, my God, I've been to multiple therapy places before. You guys already have done so much more than any other place. So that's nice to hear because it knows we're doing something right.
Yeah.
You're paying attention.
Yeah.
So you guys have been here for quite some time. We like to ask all our local business owners, how is it that you support the community?
So for pelvic floor, I do lots of Facebook Lives. We do live streams where I would actually be on exercising and the patients are following us. We have done the PT Heroes, so during quarantine, we were supporting the nurse staffs and the doctors and telling them what kind of stretches to do for their necks because they were hurting wearing all the masks and the gears, right? We have done where we go to churches and libraries and we do speeches. I do free speeches at Kane University to PT students. So we try our best to put the word out. Yeah.
That's great. One last question for you. I saw that there's an out-of-town offering that you have. How does that work?
So for pelvic floor, because it's such a niche and you can't find somebody with extreme experience and specialty. So we decided that patients would call us from different states, Florida, Delaware, Maryland, and they would fly in, they would stay in the hotel, and we would see them every day here for a very lengthy period of time, for extended like 7 days, and work on them, and they would fly back to their state. And then they would fly back a couple months later because they don't have someone with such specialty in their state.
So you do have people coming from quite far away.
Yeah. I actually have a patient from Thailand.
Wow.
Yeah.
Well, thank you, Scott. Thank you, Zarina,
Thank you so
for
much.
welcoming us into your facility here. Thank you for shopping, buying local to build stronger communities. If you like this video, please like it and share it. And please come to Cranford if you need physical therapy.
Thank you so much.
Thank you.